One, two, three, four. Oh, fourth finger, right? Well, today I met my fourth hand surgeon. It's funny how when you talk to different people, they all have different opinions. And you think about how much is reality versus in my head or somebody else's head, right? Why is it that I've talked to four different hand surgeons and they all have sort of different idea of what's going on with my finger? Right? You would think they'd be able to come to a consensus. Maybe 10? I could get at least half to agree. So I met another hand surgeon today. He said my finger is fine. I mean, I don't know. It's sort of straight, right? I mean, I don't know. I'm not an expert in Mallet's finger. I just have read up on it a little bit. But the first one said, I'm fine. Second one said, I'm fine. Third one said, obviously you have Mallet's finger, let's cast it. Last one said, you don't have Mallet's finger, but let's do nighttime splinting. And if it ever starts drooping, come and see us right away. Covers all the bases, right? But I feel one very interesting thing is the way I tell people about my finger. It really influences what they decide to do with it, right? So the first guy really didn't want me to splint it because, he knows I work in a hospital. He's a colleague. And it really is hard for me to type if I splinted it. The second guy, I just saw briefly, he said, you're fine. The third person I saw in a clinic, she didn't know my background. As in, she knew I'm a doctor, but that's about it. Nothing else. The last one knew my wife was disappointed by the fact that I have it in a splint, wonder if it'll interfere with the fact our baby's coming. And his idea was, let's go with plan A. Plan A is whatever your wife wants. And so he took it off. And I think maybe also some caveats, nighttime splinting, if it droops, come back and see us right away, etc. But he thinks it's going to be fine. And I think the idea is that we all have thresholds of comfort or discomfort. Stuff we're comfortable with, right? I think everybody thought they were doing me a favor. And I think they generally believe that, and I believe that too, right? The person really didn't think I had any issues. But because my friend had suggested it, why not just satisfy that compulsion, if you will? The second one just saw me briefly and just big overall picture, you look fine, right? That's it. Third one was somewhat worried, maybe over worried, but thought the safest thing was just to splint it for 6 weeks, which is absolutely correct, right? Just to prevent any risk of injury. And the last one, because my wife was there and he knew that she didn't like my splint, said, let's just get rid of it. We'll figure out a way to make it work, right? These are all people who are very good at their craft, I presume. These are hand surgeons. These are specialists. Not only have to finish your 6 years of orthopedics, and you do another fellowship, which is at least 2 more years. But how do they all come to different conclusions? One thing is they did meet me at different periods of time when my finger may have looked different. Now it's already been 7 weeks. Second thing is, as you go along, you collect more information, right? And last thing is, they're gauging what I want, right? My set of values. And that's something that we do commonly all the time, whether we know it or not. I gauge this patient. What do they want? Right? Because I may go into that room determined to tell my patient, hey man, you gotta lose some weight. It's not good for you to be like this. And then you see the patient, unhappy face, grumpy, And they start talking about something like how they were fat shamed or this and that. And all of a sudden, I change my mind. I'm going to approach him a little bit differently. It's all an interplay, a dance, if you will, right? I make a move, he makes a move, I make a move, he makes a move. It's all related to each other. And that's why 4 different doctors have 4 different opinions. But I guess the other lesson to be said, if you will, is what is the point of seeing more doctors? It's to get this diversity of opinions, to see what other people think. Because in the field of medicine, just like the rest of the world basically, it's not black and white. There's very rarely a right, correct, only answer. Many things are acceptable. As my attending and resident taught me, the path of medicine is very wide. And I have to say, Dr. Clark, you're right.